Welcome to Billings Clinic Health Magazine. I'm Leslie Blair, and today we're going to talk about the Billings Clinic Classic and the cause, which is the Internal Medicine Residency Program. Joining me are Dr. Alyssa Burkhart, who is a faculty member with the residency program, and Liz Wilmoth, who is our Senior Director of Development at the Foundation. Welcome, ladies.
Thank you so much.
Thanks for being here today. This is a big deal. The Classic is our largest fundraiser, and it is a huge party and a great event. And Liz has been here before, and she does a very nice job of talking about it. So do you want to fill us in a little bit on what's going on?
Absolutely. In the words of the Pointer Sisters, we are so excited this year for the Classic. We're just looking forward to a fabulous event for certainly a very worthy cause. This is actually, the Classic has been going on for over 35 years, but in its current iteration down on the streets on Broadway, it'll be our 20th year this year. So it's sort of fun that we've sort of hit that milestone. But we're looking forward to a fabulous evening. We do have the Pointer Sisters as our headline entertainment for the night, but we also have all sorts of new things that we're infusing into the Classic this year. We have a completely new streetscape, which is, you know, we've been sort of doing that same pattern. It's a very complex party to set up. We have over 33 tents down on the streets, but we're very excited for the changes this year. We think it's just going to create a lot more energy into the party, so thrilled about that. And then we're also bringing back Under the Street Lamp this year. Formed at the 2012 Classic and just blew the audience away. They're a phenomenal national touring group, so they're going to really sort of liven up the street at the post party this year. So it's going to be a great evening.
That's great. Well, it is such a fabulous evening, and I know you work very hard starting early before selling tickets, getting sponsors, selling tables, getting underwriting for the whole event and all the events. And we'll talk a little bit more about all the events a little bit later, but it's a huge undertaking, and to be the recipient of the funds, the Internal Medicine Residency Program, is a big deal. So thank you for joining us today and telling us why it is such a big deal. First of all, why don't you tell us a little bit about your background and how you became an internal medicine doctor?
Sure. I'm so very pleased to be here representing the program. It's been an honor to join the new residency program, which was launched just about a year ago now. I finished my training not in the state of Montana, actually on the East Coast, and my husband and I, on finishing, decided we really wanted to look for an up-and-coming healthcare system innovating and involved in the education of trainees. So we explored a lot of different options across the country. We visited Billings Clinic and were just amazed by the facilities here, the dedication to excellence, and I was really very excited about joining the faculty and helping to teach some of our new internal medicine residents. So we relocated here, and it's been a pleasure ever since working with the new group.
So you began working with the first class a year ago.
That's correct, yeah.
And they are now helping with the new class.
Yeah, just about a month ago, our second class of residents ever started their tenure here at Billings Clinic. So we now have the luxury of having some senior, more experienced residents helping with the education of the younger ones, which is really the way we aspire to make the program great and train a group of physicians who are dedicated to this community and really want to stay and keep working here in the future.
Well, I love the story about how you and your fiance chose to come to Billings. Tell us about him.
Well, his name is Fernando. He's a critical care physician, and we met during our training together. We both are really passionate about providing good care to our patients and working well as part of a team and with trainees. So he's had a lovely time joining the faculty here as well, and we're really excited about our futures in Billings.
And he has a different last name.
He does. His last name is Caceres. So.
And he's already working hard at Billings Clinic in our intensive care unit and with pulmonary patients. So what a bright pair you two are, and
Thank
how
you.
wonderful that you chose to come to Billings
We
Clinic.
feel very fortunate to be here.
That's
I
great.
think that's been one of the fabulous things about the internal medicine residencies. It just has brought a wealth of new, very talented physicians to our area to engage and to be part of the faculty. So it's been exciting to just see. I mean, we're so fortunate. Dr. Bush, who's the program director, is just an outstanding leader in the program, and Dr. Ficalora, and there's just a number of just very dedicated faculty.
Yeah.
We're very fortunate. So.
Well, absolutely, and I know Dr. Bush, Roger Bush, played a role in getting the residency program to Billings Clinic, and he is a Montana native from Scobie, Montana, but
Yes.
he has some big city experience working.
That's right.
In was he from?
He spent some
Washington,
time
or-
on the West Coast,
Right,
and
he-
most recently in Seattle with the
Virginia
Virginia Mason
Mason.
program. So
That's
he,
right.
I'm very fortunate to be part of a department with a lot of very experienced senior members who bring with them a lot of, experience and dedication to quality education. So Roger's our leader, but he's one of many of the other faculty members that I'm really privileged to work with. Yeah.
Now, what was your background in wanting to become a faculty member rather than just having your own practice in an organization?
Well, I always have really enjoyed the day-to-day aspects of working with a group of team members, whether it be nurses, ancillary staff, trainees, medical students. I think that everyone gains something from that, especially the patients. So I really enjoyed my time during training, and I appreciated the attending physicians that I worked with, the faculty who helped to nurture me and broaden my horizons. And both of my parents are also teachers by trade, and so they claim that that's why I wanted to participate with education, but it's just always been something I've been interested in, and I'm really pleased to have this opportunity.
Give us a little background, Dr. Burkhardt, on why Billings Clinic started this residency.
So the residency was launched just last year, as we discussed, and it was in response to a really great need for providers in the region. Montana is a really vast state with a lot of underserved areas. There are several counties in Montana and throughout surrounding states as well who don't have a single physician. And as internists, as internal medicine doctors, our mission, our goal is to really coordinate seamless care for our patients and make sure have what we call patient-centered medical home, which is basically, we want to be their advocates. We want to ensure that they live the lives that they want to live in the healthiest way possible. And I think there was a clear need to have more physicians train in this area, and especially ones who are dedicated to remaining in the area and serving these populations who really need care. So that was part of the impetus of launching the program, and I think that our current residents are up to the task.
That's great to hear. I know you shared earlier with me that some of the residents from our first class are already talking about perhaps staying in this region.
That's true. Yeah, they love, a lot of them are just really big fans of Billings in general, but also other areas throughout Montana, Wyoming, other surrounding states as well. So I think it's a really bright future for the region, and I think that the patients who have started to work with our trainees and get to know them, they feel really well cared for by them, and there is some good potential for lasting relationships there.
And talk about the new class.
Well, we have our second year class, our fresh batch of interns. It just began about a month ago. They hit the ground running. They're doing a great job. And many of them, a majority actually, are from this area. They're from Montana, surrounding states, a couple of them from this area locally, even from Billings. So they're just very dedicated to improving things for the community and staying here long term and making a difference.
Well, as someone who moved away and came back home, I know how that's in your heart. A lot of people, they say you can't come home, but I think you can come back home. I've been back for 20 years, and it's just been wonderful.
Yeah.
You have roots here, you have family, and often that's what brings people together, so that's fabulous.
Yeah.
And they're all young and eager and learning. Talk a little bit about the day-to-day of what goes on in the training program.
Well, there are many different sort of spheres where the residents work day to day. So a truly skilled internist should be able to function well in the clinic, in the outpatient setting, also in the inpatient setting with hospitalized patients, and dealing with day-to-day emergencies. And if they do, in fact, go to work in some of these communities that are that have limited resources, they're going to need to be well versed in all of these sort of skills. So day to day, things may vary. Usually we do a 1 month block at a time. So residents will either spend a month working in the clinic, taking care of primary care needs of their patients, or they'll work, mostly my role is to supervise them in the hospital setting. So dealing with patients who are more acutely ill, whether they present to the emergency room or their primary care physician identifies a need for them to be hospitalized, trying to sort of deal with the acute issues that are, affecting the patient's health and get them back on track and back out to their primary care physician in the community. So,
I know you faculty members are seeing patients as well. Talk about that a little bit.
Well, we do that as well. Yeah, our primary objective is to make sure that our residents are learning appropriate ways of caring for patients and to make sure the patients are well cared for and supervised. But there are times as well that we see patients on our own. That's an important part of teaching, is demonstrating the skills that you want the residents to take on. So, of course, we see patients as well, and many of us, more the outpatient physicians, but are developing their own practices.
That's wonderful.
Yeah.
Is it like on TV when you see the attending physician at the head of the bed and they're all gathered around? It's like, what's wrong? And Dr. House is leading the charge. Do you get together like that?
We get together like that. It's not quite so dramatic as you might see on TV. But that is basically the way we do things in the morning. The goal is to do our rounds as a team with all levels of experience present, medical students, nursing staff when they're available as well, the attending physician and the residents, and for us to discuss the patient care with the patient at the bedside and decide as a team together what makes sense with, what is aligned with the patient's goals and their desires for their care and what will lead to the best outcomes. So it's great. No 2 days are the same.
It's great to watch when the residents and the faculty are together, to watch their interaction, and just the whole process of educating young physicians is really amazing. It's very Socratic. Teaching them how to think and be critical thinkers and working through issues it's just really a wonderful thing to behold. I mean, it's worked for many years, our training system, and it's just exciting to be able to have it in Billings. Yeah, I think we're the only internal medicine residency in both Montana and Wyoming.
That's true.
So,
yeah.
Well, you know what you're talking about because you're an RN as well as married to a physician who probably you went through these fellowships and residencies and those kinds of things with Dr. Wilmoth.
When I nursed, I always worked in teaching hospitals, and that dynamic, even from a nursing staff perspective and working with the residents, was absolutely fabulous. They learned a lot from us, and we learned a lot from them. So it was a real win-win. I thoroughly enjoyed being in a hospital where teaching was an element to caring for patients. So,
Dr. Burkhart, why is that better for the patient to have being in a teaching facility when they come in and say, would you mind if one of our interns joined or one of our residents joined in?
Well, I think, as part of a teaching facility, it helps to keep us all really fresh. We're constantly reviewing the latest research, the latest data, discussing, different treatment plans as a team. Physicians in any facility are qualified to take good care of patients, but this is really a unique atmosphere, and I think from what I've heard from my patients, they really appreciate that. They feel important, and they feel as if they're contributing to the community as well by helping the residents to sort of blossom and develop their skills.
Well, that's a real nice aspect that we don't always think about. That's fabulous. Do you feel that sometimes the faculty is maybe learning some things from the residents that are just out of school?
Of course, yeah. I mean, our faculty is wonderfully diverse. We have people at all stages of training. I'm more recently graduated from training, and others like Roger Bush and Bob Ficalora that we discussed have been practicing for decades. And we all have the ability to learn things from each other. So I am blessed to learn from their experience every day, but also the residents and I and some of us who are more recently graduated may have some suggestions for more, modern or recent new treatments that sometimes doesn't come to the forefront of your mind if you've been out of training for a long time. So I think it's a really wonderful environment for learning from each other.
Liz, talk about why education has always been important to Billings Clinic.
It's actually part of our mission is healthcare education and research, and so it's something we've actually been involved with education for many, many years since our inception. I mean, we're active WWAMI participants. We have medical schools that from the WWAMI program that rotate through. We have PA students, nursing students, techs. Just the organization has always been vibrant with education, and so we're just thrilled that it's now taken on this next level. It's an incredibly complex to start an internal medicine residency, and so it's just been exciting to watch it come to fruition after so much hard work, and to watch it in action, and it's yeah.
Dr. Burkhart, talk about the collegiality among the two classes and what you're seeing that maybe you didn't see where you were in training.
Well, all training programs are different. Many of them have been established for quite a long time, and residency is about doing your work and learning, reading and studying and getting done all the tasks you have for the day. And that's certainly part of our training program here, but I feel really proud to say that that's not all of it. We have a really close-knit group, and now that we have a set of senior residents whose job it is to help monitor and mentor the interns, the first-year residents, it's really nice to see them kind of grow into that role. They suddenly recognize how much they really learned in the past year now that they're physicians, and they are excited to share that with their colleagues, which is really lovely to see. That's what we want as a community of physicians, especially across a region that's as large as this. We want people who want to work together and make each other better and ensure the really best care for the patients that we are in charge of.
So it's not just looking out for yourself and cutthroat, it's more about helping each resident come along and learn.
Sure, yeah.
I saw them one day. I know they did it both years. They sent the residents out on a scavenger hunt to find various places in the organization. And I really wish I had done that when I first came, because it's really hard to understand where everything is. And it was cute because there was a group of women, and they looked like they were on a sorority scavenger hunt, and they were just like collaborating, and they were asking people in the hallway, and they were so excited. I don't know what the prize was, or if there was a prize.
I don't know that there was a prize or not.
But they were really into it, and they were just finding some unique place that they all needed to know about. But
yeah,
I didn't know where it was, but I tried to help them as best I could. But
well, I think that was a really insightful part of orientation. Like you said, I wish we all had done that, because it really, but they quickly learned where all the important things are and met a lot of really important people in the organization and helped to get them integrated quickly. Yeah.
Well, it was fun to see them laughing and carrying on. It was fabulous. It was really fun.
They're a really positive, happy group, and it makes my life happy every day to go and work with them. So
well,
I feel
it must
fortunate.
be. It's great. Liz, do you want to talk more about the Classic and some of the events that go along with it and the money that you raise?
Sure, absolutely. So the Classic actually consists of much more than just the Saturday party, and it is a true group effort on our foundation staff that help coordinate the Classic every year. It includes 4 golf tournaments. It begins with the ladies tournament, which this year will be on August 21st, and then we have 3 open tournaments that run the following week, right before the Classic. At the Briarwood, at Laurel, and then also at Powderhorn in Sheridan, Wyoming. So, and then we sort of all converge on the street Saturday night on August 29th this year to sort of cap everything up with our finale event. So it's always a great fun. We're very close to already being sold out this year, which is always a fabulous place to be, and we're so grateful because it's really our community that supports the Classic in such an incredible way. Both our Billings Clinic family in terms of wanting to be there and support, but our community at large are tremendous in terms of buying sponsorships and tables and tickets, and everybody really looks forward to the evening. So.
Well, that's great. Are you in need of any volunteers?
It takes close to 400 volunteers to stage the Classic every year, so we are always looking for volunteers to help us with the Classic. We'll give the number to the foundation office at the end of the show, but and we can hook you into our volunteer coordinator. It's everything from coming out to the golf course and helping us with some of the tournament details to also the street. It takes us actually a full week to sort of get the street up and going. A lot of it happens at night, but then Thursday night and all day day, Saturday, is really a group effort to get everything erected and tables decorated. And but when it all comes together, it's about 5 p.m. and we just sort of look at everything, and the wind is usually just gently blowing, and it's just amazing to see how it all comes together with everybody's help.
Such a transformation.
Yeah.
I mean, you're not even sure quite where you are
Yeah.
because it's right in the middle of downtown, and it's just a fun evening. So I'm looking forward to seeing the new setup.
Yeah.
And having the Under the Street Light. Am I saying that right?
Under the Street Lamp.
Under the Street Lamp group. They were fantastic, and I'm
Yeah,
looking forward to
they really
seeing them
were.
again.
Yeah, they were a lot
So,
of fun. And this week we're doing our taste testing. Sodexo helps us in the food service for the Classic, which is always an incredible feat on their part. And so we're looking forward. Every year Chef Paul pulls together just amazing things, and so we're looking forward to going through that process this week to sort of pick what everybody will be eating that night. So
we will happily eat it.
Yeah, it's great food, it seems like, always. So will some of the residents be there?
They certainly will, yeah. We're all very excited to attend. I think the whole faculty will be there. I mean, many of the other physicians and other people in the organization who support us are happy to be there as well. And the residents, for sure, they will be front and center and excited to meet and greet and participate in the events. And I think they're as grateful as we are as faculty that Billings Clinic has deemed this a worthy cause. And I'm happy that they have.
And the reason it takes money to put on this program is because we have to pay faculty like you and the others to help train these physicians in training. And talk a little bit maybe about the simulation lab. Have you worked down there?
I have, yeah. I actually spent quite a lot of time down there. What we like to say with the residency is that we need to invest in human capital.
Yeah.
It's a little bit different than investing in a new piece of machinery or in some new, improving the facility. But really what we're investing in is the future of our region and the future care of our community.
Absolutely.
And that involves hiring faculty and experienced people like the leaders that we mentioned earlier. Also the simulation lab, which is a really modern state-of-the-art center that we have with some very high-tech mannequins that the residents and we are able to practice some of our procedures on, learn appropriate techniques before using them with patients. So that provides a really very modern and state-of-the-art way to hone our skills and be able to best serve our patients.
Well, I first saw a simulation lab at Mayo Clinic. I went on a tour there, and to think that we have that kind of a facility now where people can help with a baby being born, to help with a man having a heart attack, it's really quite amazing, and fortunately they don't have to practice on a human being, so it gives them that experience, and they're quite real. It's amazing, isn't it?
They're very lifelike.
Yeah.
And the great thing is we can program them to have any sort of medical condition that we need them to have. And so it's great for practice. It's great for simulating emergent situations to make sure that our physicians, whether they're working in a hospital setting or out in the community or somewhere without a lot of support, that they have the skills and the know-how to handle every situation that comes up. So it's a great thing to have.
Dr. Burkhart, talk about how long the program goes on and what happens next with the end of the residency when they're through the program.
Sure. So the internal medicine training track is a 3-year program. So as we mentioned, the first residents began last year, which means they'll graduate in the spring of 2017, which will be a very exciting day. Starting next year, of course, we'll have our full three-year full-fledged program in action, which will be really exciting to see. And after the 3 years of internal medicine training, the trainees will have the opportunity, if they choose, to pursue subspecialty training, for example, cardiology or gastroenterology. Or one of really the bigger focus of our program is to encourage them to consider primary care, whether that be in the hospital setting or out in the community, like we mentioned. And a lot of them have come because that is their interest. And so after the 3 years of training, we hope to find them suitable placement, whether here in Billings or around the area, and really help them to get into the community and grow their practices.
Well, I know what a blessing that will be to have physicians in regional outposts that people have to travel miles and miles. My sister was diagnosed with cancer in northern Montana, and there was a PA in her community, but she had to travel to an outreach she traveled to Glasgow, and Dr. Santella was her oncologist from Billings Clinic that would travel up there. But because we're dedicated to the region, we've done this kind of thing, but she didn't really even have a primary care doctor.
Yeah.
So it's so important to be able to serve this region where people, we've got many, many miles between a facility with care and where people live in
It's a
rural.
unique challenge. Most of the country doesn't have this sort of need or this sort of sparsely populated area that we need to cover and provide care in. So it's a unique challenge, and I think we're up to the task.
So not only are we sort of celebrating the residency, but also primary care in general. And it's one of those things. I've had the same physician here in Billings for 20 years as my internist, and we have a wonderful relationship, and he's such a partner in my health. And it's one of those things that I think it's so easy to take for granted until you're in a situation like your sister's where you don't have that. And just think about what your life would be like without, you know, access to a physician. I mean, it's important. It's important to a good life. So.
And I'll put in a little marketing plug, if I may. We do have more availability now of primary care physicians with all of you here, with the residents here, the faculty, and we've expanded our primary care department so people can get in. And like you mentioned, the medical home, there are nurse practitioners, there are physician assistants, there are social workers, there's a pharmacist, there are others that work on your team. So generally, we can try to get someone in same day if they have an issue.
That's true, yes.
And not wait for weeks to get in for your annual visits. So I've been fortunate with my doctor to be able to, I can get right in to see the nurse practitioner, and I'm looking forward to seeing her in a week because I needed to get in. So it just really helps to take care of little things and the whole picture of keeping people healthy and having a good life, as you mentioned earlier.
And just as an example, often patients will come to the clinic or say they're admitted to the hospital, and the resident that is their primary care physician is there on site. And so whether they can sort of move between those two worlds very easily and care for the patient and the family and communicate well with any subspecialists or to really coordinate the care well as part of the medical home. Regardless of the situation that the patient's in. So it's not a very common thing that we see across the country these days, and we're really proud to have that as our model here.